Welcome back. Before we went on our break, we were talking to our distinguished guest, Dr. Ahmed Mushtaque Chowdhury, Vice Chair of BRAC, about poverty alleviation schemes and projects of BRAC, and also their projects about public health. Before we ask a question to Dr. Mushtaque, I would like to read something from another very distinguished person. BRAC has done what few others have. They have achieved life-saving health programs to millions of people in the world's poorest regions. And that was Mr. Bill Gates. That's quite a tribute. Yes, Dr. Ahmed Mushtaque. We were talking about the articles that have appeared in the British medical journal Lancet and their focus on Bangladesh. You said 6 articles. Health progress and research culture in Bangladesh, and that how do you go about improving the health? I mean, by distributing medicines, providing better education, health education, by making sure that at the first instance of somebody not feeling well, he either goes to a clinic, takes medicine, improving the life expectancy, providing medical care to pregnant ladies, prenatal services, natal services. How do you go about that?
Well, in health, in improving health, what is need to be done? There are 3 things. One is to do preventive health,
right?
Such as immunization, for example. Then you also have to do promotive health, for example, exercises and those kind of things. And then when somebody is sick, you have to provide curative care.
Right.
So these 3 have to be there in a health system.
Right.
And fortunately, Bangladesh has been doing very well with respect
preventive, promotive,
and curative.
Right.
So fortunately, Bangladesh has been doing quite well in preventive.
Right.
So for example, I was talking about immunization.
Right.
Bangladesh has one of the highest immunization rate in the world now. We have over 80% of our children are being immunized regularly, which is much
against polio,
against polio, tetanus, whooping cough, and all. Many of the
who provides these the
vaccines?
Vaccines, yeah.
Well, the vaccines are provided by different international organizations.
UNICEF and all that.
UNICEF and also the Gavi, which is the Global Alliance for Vaccines and Immunization, which is a some of the money comes from them. The government itself also buys vaccines too.
And these are locally produced vaccines.
Vaccines are not produced in Bangladesh, unfortunately, but the drugs, the medicines are produced in Bangladesh. So I will come to that later. And so in terms of preventative care, Bangladesh has done very well. Until the mid-80s or 90s, for example, diarrhea was a major cause of death in Bangladesh for children. So BRAC, for example, they went from house to house in Bangladesh, every house, and taught how to make oral dehydration solution at home with salt and sugar. So that has made a huge contribution in reducing childhood deaths. Now Bangladesh has the highest ORT use rate in the world because of those kind of things. But apart from that, in terms of the curative care, you have to have doctors. But fortunately,
also good health practices, like, I mean, you talked about diarrhea. So I understand that most of the diseases are waterborne diseases.
That's right. That's right.
So if they don't drink clean water, they will suffer from different kinds of diseases.
So water and sanitation are major important part of that. Until the mid-90s, we knew that Bangladesh was doing very well in reaching 90% of the population with clean water.
Right.
Then we discovered that we have arsenic in water.
Right.
Which meant that about a third of the population were drinking poisonous water. There are a lot of talk about...
What does it cause? I mean, what harmful effects are?
Well, the arsenic comes in the drinking water through the tubewells.
Yes.
Because, and that's a natural
I've lived in North Bengal for some time, so I know. Your teeth go gray.
Exactly, and then you have skin lesions, and also there are theories that it will lead to cancers and so on. And there are some studies now, research, which are showing that there is an increased death, for example, but it hasn't really become a kind of a major problem as yet, fortunately. But which is the thing which is unfortunate is that we know that this is a major problem.
Right.
But we haven't been able to do anything about that.
You haven't tackled it, not addressed it.
Not yet. So this is a forgotten issue. Now,
is that good or bad?
It's bad. It's bad. We have to do something about that. The other thing, which is a good thing, is the coverage by sanitation, the latrines, for example.
Right.
And Bangladesh has done very well in that. So one of the indicators of sanitation is what proportion of the population are defecating in open space.
Right.
And in Bangladesh it is less than 10%. But if we compare with India, in India 50% of the population defecate in open spaces.
Right.
So in that also Bangladesh has done quite well, actually. So that's the promotional thing, which is also part of prevention as well.
It can cause diseases, isn't it?
Or, I mean, diarrhea, for example, or other sort of vector-borne diseases, which are caused by
this is, a lot of people would, I mean, with the tongue in their cheek, they would say this is human fertilizer. But does it really work like that?
Human fertilizer?
I mean, defecating in public.
Oh, I see.
In the farming areas.
Yeah, but then it has to be done in such a way that it doesn't cause a problem to the human.
Right.
Health problems, for example. I mean, it can be a good fertilizer, and it is being used in many countries, for example, not only as fertilizer but also to produce gas, for example.
Right, it can be recycled.
It is. So the other question is about the curative thing.
Yes.
And for that, obviously, I mean, if you have a disease, you need a doctor to treat you. But Bangladesh is a country where there is an immense shortage of doctors and nurses.
Yes.
And
we have I think about 60 medical schools, isn't it?
Yeah, there are about 17 in the public sector, and there are many in the private sector. Also, there are questions about the quality of those.
Yes.
I'm not going to that. But then the number of doctors, whatever number of medical colleges are there, we know that we won't be able to train the number of doctors that are necessary for the country.
Needed. So what is the ratio now? One doctor serves how many in the population, like 1,000 persons or?
Yeah, 10. I mean, it's
1:2.
It's 0.3, for example, per thousand population, which is much lower than any other country.
A lot of doctors, sorry to interrupt you, a lot of doctors also don't want to work in the rural areas.
I mean, that's a perennial problem. I mean, it's not only, of course, in Bangladesh, but also in other countries. So we have this problem that we don't have enough doctors, and we don't have doctors staying in the rural areas. So what is the alternative?
Right.
So the alternative is what we learned from China, for example, is the barefoot doctors. Right. So when you don't have a trained doctor, you train a local person and provide them a limited education to deal with the common problems.
Yeah. Common medical problems.
Common medical problems. I mean, and we have been able to do that actually in Bangladesh. For example, many of the NGOs, Ganashastra Kendra or BRAC and others, they have trained thousands of community health workers.
Alhamdulillah, Dr. Zafrullah Chowdhury was also here sitting on the same chair.
Was here. And he's a legend also. He's a legend.
All of you are doing a great job. See,
thank you.
That has to be highlighted too.
Thank you. So I was talking about the community health workers.
Right.
So BRAC has, for example, about 105,000 community health workers. And the challenge is that how do you really create an incentive for them, because they are health volunteers. They are not paid by BRAC, for example. So that's one challenge. The second challenge is that how do you connect them with a health system? So BRAC has its own health system, and we have provided them some short training, and then we bring them to our centers once every month for refreshers training. So that's how we have been trying to sort of address the
Are you producing doctors at BRAC University?
Not yet, no. We don't have a medical school as yet.
Where is BRAC University? Is
BRAC
it in
University,
Dhaka?
well, we have two campuses, one in Dhaka, which is in Mohakali, and then we have a rural campus in Sabar.
I have a quotation here again, see, and I go back to it. It's a very interesting one. See, BRAC tackles the causes of poverty and helplessness at the root and plants trees of hope. It's a very interesting way it has been put, and he's a Nobel laureate, Wangari Maathai. Really, how do you tackle poverty? I mean, I know that you can educate people, you can give them food, you can give them education to work, but what is the way that you will judge, you will monitor, this man does not need any more help, now we have got to go to the neighbor. How do you do that? With the help of your 100,000 volunteers?
Workers? Well, there are many ways that this is done. But let me talk about the microfinance program,
Right.
which is microcredit.
You have a bank too.
We have a bank as well.
Why do you need a bank?
Well, there's a commercial bank, and we felt that there are certain group of people who are not being able to access credit.
Yeah.
Those who are between poor and the rich people.
Yes.
So they didn't have any access to credit.
Yeah.
Who can set up the small and medium enterprises, the SMEs. So we thought that if we set up a bank.
Like similar work like that's being done by Grameen.
No, Grameen is doing the microcredit,
Right.
which is for the poorest actually.
Right.
But this is a little higher than that.
Right.
Little higher than that. And the idea is that these people will be entrepreneurs, and they will be creating jobs, which will employ the poor people.
Right.
So that was one of the ideas why we thought that we should set up a bank, a commercial bank. But that's only for the sort of higher of the poor, for example. Then there are two other groups within the poor. The poor between 10th and 50th percentile, for example. So the microcredit is appropriate for this group only.
Right.
But then, and then we have the poorest 10% of the population who don't want
the hardcore poor.
the hardcore poor or the ultra poor or the extreme poor. And for them, a microcredit is not a solution because they don't want it. They know that they won't be able to use it properly. Right. We knew from the late 80s that BRAC microfinance program was not being able to reach that particular group. And obviously they are the most neediest people. So what can you do about that? So we experimented and we found that these people actually need support,
Right.
direct support, not loans. They need skills.
Right.
They need some assets, whether it is a cow or a goat or a small shop, for example, that they can use that in order to earn an income. And also they need some sort of food support during this period. So we provide that for 18 months. And we have seen that in 18 months, these people actually get out of the ultra poverty and are able to access microfinance. So that's the graduation process.
Right.
And we have already been able to get about 500,000 of the ultra poor out of poverty.
Very briefly, Dr. Ahmed Mushtaque, tell us for our viewers, what are your future plans?
For BRAC?
Yeah.
Well, we feel that we should be continuing to be relevant for the country,
Right.
and as well as internationally as well. Obviously, the need of the poor will change. So will our programs. And we feel that the university and other things that we are creating will continue to serve.
In the long term, like say about 20 years, 30 years, do you see a Bangladesh which will be poverty mukto, poverty free?
We are very certain about that, and we are very hopeful about that. And,
It was a pleasure having you with us, Dr. Ahmed Mushtaque Chowdhury, Vice Chair of BRAC. Thank you very much.
thank you very
And
much.
thank you for bringing sunshine from Dhaka to London.
Thank you.
Dear viewers, thank you very much for being with us, and it was a very interesting discussion, and I hope that you have enjoyed it as much as I have. We will see you again next week, same time, same channel. In the meantime, take care. Thank you.